In the United States, legal access to the abortion pill, Mifepristone, hangs in the balance. It follows an unprecedented ruling by a judge in Texas who suspended the FDA approval of the emergency medicine. In Washington state, another federal judge issued a ruling ordering U.S. authorities not to make any changes to the availability of the drug. Toni Waterman has more from Austin.
In this 67-page ruling, Judge Matthew Kacsmaryk sided almost entirely with the group of anti-abortion doctors that filed this lawsuit. He said that when the FDA approved Mifepristone 23 years ago, that it acquiesced on legitimate safety concerns and that it had succumbed to political pressure. He also said that in the decades since, the drug had resulted in many deaths and life-threatening adverse reactions. Now, medical experts would strongly disagree with that. Mifepristone has repeatedly been shown to be safe and effective, and serious complications are exceedingly rare. In fact, it is less risky to take than penicillin and Viagra. But this decision is completely unprecedented because you have a federal judge overruling the well-trained scientists and doctors at the FDA. And this could undermine the credibility of the institution, which is responsible for assessing the safety and efficacy of all the medications and medical devices that are used in the United States. It also raises serious questions about whether other drugs could be pulled or challenged in the future, things like contraceptives or the morning after pill or the second medication that is used in pill abortions, which is Mifepristone. The judge also dredged up this 150-year-old federal law that bans the mailing of any sort of abortion drugs or devices. This is problematic because during the pandemic, the FDA had loosened regulations about sending the pills through the mail, and it became a lifeline for tens of millions of Americans. Half of the abortions that take place in the United States are medication abortions. So this ruling could have serious implications. Mifepristone is not going to immediately be flying off the shelves because the judge said that it would not be enforced for a week, giving time to the FDA to appeal this ruling, which it has already done. What happens next is that this is likely going to head to the Fifth Circuit Court of Appeals, which is a conservative court, and then it's likely to head to the Supreme Court, especially since there was a ruling that came out on Friday as well from the state of Washington ordering the FDA to keep Mifepristone available for 17 states and the District of Columbia. So you have these competing cases, which means this is likely going to land at the Supreme Court. It's the same justices at the Supreme Court that we saw last year when they overturned Roe v. Wade. So it'll be interesting to see how this plays out, but definitely a lot of decisions and a major showdown coming in the week ahead. Toni Waterman, CGTN, Austin, Texas.